Woke ideologies have infiltrated the medical community, and children are paying the price. Welcome to Freedom Alive. Do No Harm is a 12,000-member coalition of physicians, nurses, medical students, patients, and policymakers focused on keeping identity politics out of medical education, research, and clinical practice. Dr. Jared Ross joins us to expose how children are being harmed while lining the pockets of doctors. I'm thankful to again be joined by our co-host, Matt Staver from Liberty Counsel. And Matt, we acknowledge that it's biologically impossible to change one's gender. That's just a fact. You're either male or female, and that settles it. But it seems criminal that the medical community is taking advantage of children who are confused about their gender.
This is absolutely ridiculous that we're even having to talk about this, that there are two genders, two sexes, male and female. Your DNA is either one way or it's the other way. You're either male or female. And it doesn't matter whether you ingest certain kinds of drugs to block the production of different hormones like estrogen or testosterone, or take other drugs that are competitors to the hormones that you're born with, and then go through plastic surgery. It doesn't change anything. You're still either male or female. And this gender ideology is really harming children, because a lot of children will come in and have different kinds of depressive situations, psychological issues, maybe on the autism spectrum. And instead of dealing with that underlying issue, they give them this false hope that, well, maybe you were born in the wrong body, and we can fix that with drugs and this mutilating surgery. And it's the doctors and those that are pushing this ideology that are making a lot of money off of these children, off of this lie that's permanently harming our children and next generation.
Absolutely. With every episode of Freedom Alive, we love to bring you truth. And this is such a hope-filled story that we're about to share. But our Freedom Alert is next.
This Christian university is entitled to employees with aligned religious beliefs. Liberty Counsel has filed a legal brief on behalf of Liberty University asking the federal district court to dismiss the lawsuit Zinsky versus Liberty University. Jonathan Zinsky is represented by the ACLU. 4 months before applying to Liberty University for employment, he began taking female hormones. However, Zinsky knew the university's doctrinal position and agreed to adhere to it. But as soon as his 90-day probation ended, Zinsky revealed his secret to the university and then demanded Liberty University depart from its doctrine and mission. Yet Liberty University has the right under the First Amendment, the Religious Freedom Restoration Act, and Title VII of the Civil Rights Act to uphold its sincere Christian beliefs and doctrinal statement. Employees can also be required to do the same.
Up next, Matt's interview with Dr. Jared Ross.
I'm pleased to welcome to Freedom Alive Dr. Jared Ross. He is a board-certified physician with over 24 years of experience as a paramedic, firefighter, and also an educator. He's an assistant professor of emergency medicine at the University of Missouri, and he has many other activities to his background. Welcome to Freedom Alive, Dr. Ross.
Matt, thanks so much for having me. An honor to be on the show with you today.
And you are a senior fellow of Do No Harm. I want to talk a little bit about that. But before I do, can you share a little bit of your professional background with our viewers? And then we want to move into what you do with Do No Harm and what all of that is about.
Yes, Matt, you said it very well. I'm an emergency physician, originally a firefighter and paramedic, and have been very involved in medical education over the last several years in both public health and pharmacology.
And you're also part of an organization called Do No Harm. Obviously, we know that from the Hippocratic Oath, from so long ago that was part of the Hippocratic Oath. What is Do No Harm?
Yes. So, Do No Harm is an organization, as you mentioned, named for the Hippocratic Oath, in Latin, primum non nucere, or first, do no harm. And we saw all of the harm that was being done in medicine in the name of radical ideology. And so we founded the organization to return medicine to its roots, to provide the best care for the individual patient that's in front of us, and to depoliticize medicine and restore us to our Hippocratic Oath.
How did you get involved in doing this as a physician? Obviously you're practicing medicine, emergency physician, you're on call a lot, and a lot of emergency situations you're dealing with. How did you get involved in wanting to speak out and be a part of a change within medicine, particularly with regards to this ideology that, frankly, is doing the opposite and harming people?
Yeah, thanks for the question, Matt. I was very impressed when I found out about Do No Harm. Dr. Stanley Goldfarb, who was a medical school dean and honored professor, started the organization after he was kicked out of his university for speaking out against DEI, or diversity, equity, and inclusion initiatives that prioritized the admission of medical students based on their race, gender, and sexual orientation rather than on their individual merits. And I joined the organization as a member, and then became further involved after I had an individual experience with DEI and implicit bias.
What kind of experience did you have with the DEI?
Well, I'm board certified in emergency medicine by the American Board of Emergency Medicine. I have to maintain those credentials every 10 years. And in doing so, I was asked to sign a pledge stating that I would do everything in my power to mitigate explicit and implicit bias. And I don't believe that implicit bias exists, and I don't believe that it can be mitigated. And so I was not willing to sign a pledge to do something that I felt went against my individual strongly held beliefs. And so I reached out to Do No Harm and have since become more involved as a senior fellow with the organization, working on both the DEI issue and most recently, very extensively, on the gender ideology front, protecting innocent children.
Well, and we know, even using the word implicit bias, I mean, being white, being Caucasian, some people with this radical DEI indicate that just being white is itself bias, and that you have to deny your whiteness, whatever that is. It is a radical ideology that has clearly affected all professions, and in your profession. One of the things that Do No Harm has done is create a database called Stop the Harm Database. What is that about, and what are some of the stats or statistics, the situations that you have seen with regards to how this gender ideology is harming medicine and particularly patients?
Yeah, Matt, thank you. We all see the harm that's being done to children, to innocent children, that's justified by this radical gender ideology. And in the past, it had not been quantified. And the excuse was that this isn't happening, or that if it is happening, it's exceedingly rare. So we undertook this process to see exactly what was going on, to pull back the curtain. Do No Harm is a fact-based and evidence-driven organization, and we wanted to shine a light on this medical industry, to provide information to concerned parents, policymakers, and the general public. And what we found is, frankly, very concerning.
So give us some of the specifics about what you have found.
Yes. So we found nearly 14,000 children receiving sex change treatments, and that includes nearly 6,000 child sex change surgeries, with billing of nearly $120 million.
Wow, 14,000 children. I know we have people coming forth now, it seems like the pendulum may be swinging, hopefully, for some more common sense. Those that have been told they may be suffering some level of autism or depression or body dysphoria, whatever it might be, that the panacea that is in front of them is if they take puberty blockers, cross-sex hormones, and go through these surgeries, that all will be well. And people like Chloe Cole have found that it's just exactly the opposite. They've mutilated their bodies, and they still have the same situations that they suffer from. How has this infected the medical community? The medical community, it would seem like from a non-medical perspective, should be based on science. How did this ideology get into the medical community?
Yeah, you mentioned Chloe Cole, and I've had the honor to work with her. What an incredibly brave girl she is to speak out against this. And it's a shame that we have come so far to be doing this harm. As I say, it's the new lobotomy. We followed the European model, specifically the Dutch model, to providing this care, and I say that in quotation marks, to adults and then to children. And the Dutch have reversed course. They have seen the terrible and permanent harms that have been done. We've seen a reversal of course in Finland, in Sweden, in the UK, but unfortunately that trickle back to the U.S. Has not happened as quickly as it should. And I know it's ironic to say that the U.S. should emulate Europe, but this is a situation where we really desperately need to.
You said there's 14,000 children. These children have gone through these surgeries. I call them mutilating surgeries. I know there's lots of different terms for them, sex reassignment surgeries. We know, for example, that you can't change your DNA. But what are some of the specific situations that you have found among those 14,000? Every one of them is a story. Do you have any specific instances of those people who have regretted, been harmed? And then also, who are the worst offenders? Some of the hospitals, we'll talk about that in a moment.
Well, as you mentioned, we have 14,000, nearly 14,000 children in the database, nearly 6,000 children who received sex change surgeries, and nearly 9,000 who received hormones and puberty blockers. This database was gathered from 50 billion insurance claims over a 5-year period. And mind you, this did not include any patient names or any patient identifiable information. So we're not able to extrapolate down to these individual patients and track them up for follow-up due to privacy regulations. But we are able to see the physicians that are doing this, the hospitals, and these private surgical centers as well. And I'm happy to talk more about that.
There's a doctor down in South Florida. She has a nickname called Dr. Titus Deletus. I don't know if you've ever heard of her. But she prides herself at how many breasts of young women, girls, that she can amputate in a week with smiley faces or frowny faces if she didn't get enough. I mean, those kinds of doctors, to me, seem like they're committing malpractice, and they should be stopped from doing what they're doing to these children.
Yeah, I think that's, really narcissistic behavior. As a physician, I'm here to take care of patients and do the best for patients. I'm not here to fulfill my own desires to perform surgical procedures on patients. I'm there to do what's best for them and not to advertise it on TikTok.
Dr. Ross, help me to understand, and I don't know if there's a way to understand this, but you're a physician, and say now you're a plastic surgeon or whatever, and a person comes into you and they're 13 years of age, or 14 or 15, they're a minor, and now they want their healthy breast amputated. How can a physician get to the point where they accommodate that request of a patient?
If we go down this route of, first of all, accommodating every patient request, we then cast doubt on the value of our whole Western medical education system. Why did I spend 4 years in college, 4 years in medical school, a year of internship, 3 years of residency, to just kowtow to what every child wants, every child comes in and asks for? So that's our first challenge. And then our second challenge there is, where does this stop? Do we say, I want my leg amputated, I want my eye removed? And we see this slippery slope in Canada, where we have the broad expansion of medically assisted suicide.
Mm-hmm. I know when we had our very first transsexual case, Canteras versus Canteras in the early 2000s at Liberty Council, we began to study other psychological conditions, one of which is apotemnophilia, which is a condition in which someone thinks that they are a disabled body inhabiting an abled body. So what you just said about amputating a healthy arm, a leg, a foot, is not beyond what actually happens. There are psychological conditions, and there are reported cases, particularly in Mexico, where that has actually happened, where they've amputated a person's leg because they think that they should be an amputee, even though there's nothing wrong with their leg. There is no difference between that kind of situation and amputating the healthy breasts or other genitalia of someone who has otherwise psychological issues to deal with. Now, you said that you have a list of doctors. Can the list of doctors be known, or do you have that available on the Do No Harm website, which is actually donoharmmedicine.org? Is that available, or are the other hospitals that are engaging in this kind of procedure? Is that available as well?
Matt, our list of hospitals, medical centers, and surgical facilities is published on our database. There's a link at the top of our website, donoharmmedicine.org. And we also have a dedicated website for the database. Your viewers can go directly there. That's stoptheharmdatabase.com. And we do have those lists there. We have not yet released the list of individual physicians, but that is something that is in progress right now.
So you will, you're considering doing that, where you could go there and people could find out who these physicians are? Like, for example, the physician I just mentioned down in South Florida, those eventually may be available on your website?
Yes, this is not a one-time project for us. This is an ongoing and evolving database. We have 5 years of data currently. We're coming to the end of 2024 here, and within the next few months, we plan to integrate another year's worth of 2024 data into the database, and that this will be a living and hopefully not growing database. But we want to show that the change that is happening here.
You know, you mentioned lobotomy early on. For those who haven't really researched the history of lobotomy, I would encourage you to do so, because I think this really does, as you mentioned, fall in the same category as lobotomy. And historically, I hope it has the same fate as lobotomy in the future as we look back at it now, where, you know, the doctor was using the equivalent of an ice pick to go in through your tear duct to touch your frontal core of your brain for psychological conditions. And it was that actually affected a relative of President John F. Kennedy. So it was something that affected their family because one of the family members had that situation. We have totally rejected that now, but going back at the time, you had the same pressure among physicians that this was the thing to do. This was the thing to do for addressing psychological issues. And now we've rejected it. I think this will be in that same category. You have on your website what's called the Dirty Dozen, the worst offending children's hospitals promoting and performing these procedures. What is that based on? And can you give us a list of some of those Dirty Dozen?
Yeah, thanks so much. Yes, our Dirty Dozen is our 12 worst offending children's hospitals, and we stuck specifically with the children's hospitals because these are hospitals that have a goal of taking care of our most vulnerable of our population, and instead are are mutilating and defying the trust that they receive. They also receive a countless amount of funding on a state and federal level, as well as very generous donations, because again, sick children are something that pulls at our heartstrings, but these are organizations that are perverting medicine and using it as a cover for their radical ideology to mutilate children.
And what are some of these hospitals that you might be able to name?
Yeah. So number one on our list is the Children's Hospital of Philadelphia, which goes by the moniker CHOP.
CHOP. That's the moniker that they use for this gender ideology where they actually do the mutilating surgeries?
Yes, a little bit more than
that's not a negative thing that somebody put on. That's the name that they've chosen?
That's the name that they've chosen, yes.
Unbelievable. Wow. I mean, that's just hard to imagine. What are some of the other offenders?
Yeah, number two is Connecticut Children's Hospital in Hartford, Connecticut. Number three is Children's Minnesota in Minneapolis. And number four is Seattle Children's. And number five is the Children's Hospital of Los Angeles.
Where does Boston's Children's Hospital fit into this? Are they on the list?
Great question. That's number 6 right there, Boston Children's.
Yeah, they have had a history of this. And so some of these situations of stories I've heard with these families may take their child to one of these hospitals. They may have a psychological issue, a behavioral issue, whatever. They take them to the hospital, and then the doctors take them aside and suggest to them that, well, maybe they're born in the wrong body, and they need to change their name, and they'll give them some drugs and go through some surgery eventually, and then come and tell the parents that you need to now refer to your son as a girl or your daughter as a boy or whatever it might be. And when the parents refuse to go along with that facade, then the parents become the problem. Have you seen some of that in your practice or in your discussions?
Yes, we know of a number of states and cities that have become sanctuary cities and states for these children who are really struggling. And these children need their parents. They need to be grounded in reality, not defying biology. But instead, these states are saying, we're going to take your child away from you, take custody of the child, make the child a ward of the state. We're going to use taxpayer funds to provide puberty blockers, cross-sex hormones, and mutilative surgeries to your child, and we're going to keep your child from you. And unfortunately, there's a number of states that are doing this.
I know, of course, the former vice presidential candidate with Kamala Harris, Governor Tim Walz of Minnesota, has signed laws to make Minnesota a sanctuary state for trans, so that if a minor flees to Minnesota, even though there's parental rights and guardian rights from another state, they will not return the minor back to their parent or guardian. Or if divorced or some kind of domestic situation, one parent or guardian takes a child into Minnesota to have these kinds of surgeries, and there's a court order from out of state, despite federal law, they refuse to honor the out-of-state court visitation and custody order from another sister state. It's unbelievable what's happening there. But this is a real issue. So some of the hospitals that you have, I would encourage people to go to the DoNoHarmMedicine.org website and look at the Stop the Harm database and other information, the Dirty Dozen, because you have to be careful if your child has a psychological or behavioral issue or some other kind of medical issue. They may have broken their arm, and now you want to take them to one of those hospitals. Be careful when you find out that this hospital is on the list. I know that Do No Harm organization has 12,000 members. It's a coalition of physicians, nurses, medical students, patients, and policymakers focused on keeping identity politics out of medical education, research, and out of clinical practice. How can someone in one of those categories, medicine, for example, or just the individual who might be a policymaker or others, how can they support, how can they become a part of this growing coalition?
Thanks, Matt. We're growing so fast, we can't even keep the website updated. I just received an email this morning that said we're up at over 14,000 members now.
So you're growing quickly.
Growing very quickly. The organization's only been around for just over 2 years now. So we resonate with a lot of people, with medical professionals, doctors, nurses, but also with concerned parents, members of the general public, and policymakers. And your viewers can visit our website, again, donoharmmedicine.org, and join us, become a member. We have a wonderful newsroom with resources that's constantly updated. Aside from the minor gender ideology, we do a lot of work in restoring merit to medical education, making sure that your doctors are picked based on their skills and ability, not based on the color of their skin. And we do a lot of work to make sure that medical care is provisioned based on your needs as a patient, not based, again, on your skin color or who you choose to sleep with.
Well, thank you, Dr. Ross. Dr. Jared Ross is a senior fellow of Do No Harm, a board-certified emergency medical surgeon, and is a strong voice for sanity and reform in the medical profession. I assume that during testimony on the state level, when some of these laws are being debated, we could contact Do No Harm at the website and perhaps get some expert testimony from your organization as well.
Absolutely, Matt. We have some wonderful members who have testified. You mentioned Chloe Cole. She has testified on both the state and federal level, and amazingly brave. And we are always there to help support this on a state level as well.
Well, Dr. Ross, thank you for joining us, for being a strong voice on Freedom Alive.
Thanks so much for having me, Matt.
Matt, I have to say, watching episodes like this, I am so thankful that we're able to do Freedom Alive together like this and shed truth on issues such as this. And I just put myself in the position of someone at home. If you're watching this issue and you're not, maybe not close to it, and you hear things like new lobotomy, you hear infected medicine, and you hear what Dr. Ross is talking about, you would think that it's make-believe. Like, what am I listening to? But this is so very real and is happening.
Yeah, well, you would think, for example, that you would want a doctor that has been selected for medical school, that has the qualifications to get into medical school, because you want the best kind of doctor. So the list of hospitals that Do No Harm has is something that every parent, every grandparent ought to know about and be careful about taking your children to these hospitals.
Thank you. In closing, remember 1 John 3, verse 18, which says, "Dear children, let us not love with words or speech, but with actions and in truth." Our freedom is a gift from our Creator. We must never forget that and always protect it. So join us here next time, where you'll hear victories as well as ways you can stand up for your priceless freedom. Join us again for Freedom Alive.